Hi, I'm Dr. Erica Lacher from Spring Hill Equine and the podcast Straight from the Horse Doctor's Mouth. And today we're going to talk about how I evaluate backs. There's a million reasons why we need to evaluate a back, but the big one that everyone thinks of is kissing spine. Although I'll tell you, kissing spines is a radiographic diagnosis, not a functional one. So what we're going to do today is emphasize how well the back moves and grooves and where sites of pain might be so that we can evaluate what the source of the back dysfunction might be on your horse. I always start with my hands. They're the most sensitive diagnostic tool I've got, and horses dig them. So here we go. The first thing I do is run my hands down the back just to get an overall palpation. And I'm not putting any pressure here, I'm just feeling. I should feel that everything is nice and smooth. I don't feel any knots. I don't feel any divots or bumps up and down. Everything should just be sort of a smooth flow from the back of the shoulder blade to the front of the flank whorl. I'm gonna also do that with one hand on each side so that I can get an idea palpation-wise how they feel from a symmetrical standpoint. I'm also gonna do that same thing from the back, looking down on them to get a visual of how symmetrical their musculature is. And let me show you how we do that. Okay, I like to get up high because it gives me a better look at the musculature down the horse. One of the things you want to be aware of, which we don't have at the moment, is that your horse is perfectly square. It is really helpful for this part of things to have a handler up front to really get them set square and then have someone up front making sure that they stay that way. But this allows me to assess the musculature from the top down, seeing where we have unevenness going on. And you will have unevenness. No horse is perfectly symmetrical. So it's just identifying where that is. The other thing I like to do from here is a butt tuck and see how they handle that. Much like we came a hand off of the top line to do down the side, we're going to do a hand off the spine here to do this one. So I like to take my hand, I put it against the spine, and then I'm going to take a line sort of right here. I do both sides at the same time. And again, you can use your fingers, you can use hoof picks, I've used mane combs, kind of anything with a little bit of a corner to it. And you can see, so here, she's flexing her pelvis, or she's extending her pelvis. And then I'm going to continue to go down. And again, this is a tickle spot, so every horse has it. It's just finding it. So there we go. We're asking her to tuck her butt, and I'm seeing what she does. And you can see she doesn't like to do it symmetrically. And that's what we're looking for, is to see what is that response on here and the information that tells us. So again, for us on her, it tells us she's not super symmetrical in her butt tuck, and that's probably something we need to evaluate further and then do something to manage it. Okay, we've got a feel with no pressure, so now I'm going to start adding pressure. And there's a few ways that I do this. I'll use my finger. I'll use the point of a hoof pick, but not particularly hard. Ballpoint pens work well. I also frequently use a needle, a big gauge needle inside the cap and the hub. So I'm not poking them with the needle, I'm poking them with the needle cap. So I will take my finger about a hand's width off the top and just make a line down. Now you see she flinched away. That's actually a normal reaction. It's a tickle spot for horses. And just like you or I, if you stick your finger in my armpit, I'm going to flinch because it tickles. What I'm looking for is how much pressure does it take to do that? There I'm doing it with less pressure. And is she smooth about it? Also, as she does it, how do the muscles look? So on Kai here, for example, as I do this, she flinches away, but the muscles contract in a very smooth way. I don't have any areas where I see muscles contracting harder or softer. The entire back contracts very similarly as I do that. So that's what we call extension of the back, where they're flexing it away from you. And the next thing we're going to look at is flexion. And there's a couple of different ways we can do that, but one, and it depends on the horse, but I always try, I'm going to do that same sort of motion, and I'm going to do it on her midline of her abdomen. And I usually think About midway between front and back is where I can get the most reaction. This is a place where sometimes you need a hoof pick to get in there a little bit. But I come along the bottom and I'm just going to irritate it. And she's not doing it very dramatically here, but there we go. You'll see a couple of things are happening. First, you guys may not be able to appreciate, but she's coming off of her left hind leg when I ask her to do this. The next thing she's doing is bringing her back up, but not particularly well. So she's one that I'm gonna go grab a hoof pick and see if I can get a better reaction. Okay, so I'm gonna use the tip of a hoof pick, and I'm not thinking that I'm gonna dig this in. I'm just gonna add a little bit of pressure with it. You can often get a bit more with this than you can with your finger. So again, I'm gonna start on the midline, and oh, there you go. You can see she raised her back up way better with that, and I'm barely using pressure. So it's just a matter of sort of the tool more than it is the pressure. It's making her a little bit tickly. Again, she's coming off the left hind, which is, I can tell you why she does that. It has nothing to do with her back, but we're actually just gonna look and see she raises her back up pretty effectively. And then I will also go back again and say, okay, now that I've raised it, how do you drop down? And she does that movement really well. So we'll go through it a couple of times, and I just want to see how does she do. And she does pretty well with it, as expected. That's why she's the model today. But you'll see that as you do this on some horses, they will drop down really well, or they'll raise up really well, but they don't want to do the other, and they really don't want to switch between one or the other. And that tells us that we have pain going on, primarily in the musculature typically. You know, it can be an indication of kissing spine, but it can be an indication of a lot of other things. The other thing that I'm doing, again, as I'm doing these, is I'm seeing where do I get the strongest reaction. So as I start to add pressure, some of these horses will get really painful, in particular up in this area right behind the shoulder blade, kind of the pocket of the withers. When I see that, it's saddle fit until proven otherwise. And I don't care what saddle you guys have. It might be the biggest, the bestest, the baddest, whateverest. It's saddle fit until proven otherwise, no matter what the rep for the saddle brand says to you. So paying attention to pain in this area will tell me saddle fit. The other place that I will see pain from saddle fit is at the back edge of the saddle. That usually tells me that something is going on with the gullet of the saddle, that they aren't liking the way it's hitting right here. Like right now, I have pretty significant pressure on her right here, and she doesn't care, and that's how it should be. So those are sort of some movement tests, some pain tests. One of the other things I'm gonna do is look for, do I see spasming of these back muscles? And the way that I do that is right at the top of the flank whorl, there's sort of a divot here. And if you take your thumb and you kind of hook up under that muscle, you will pick up these back muscles here. And what you're looking for, and it's often very subtle, so you have to do it to see it on your own horse, but you'll see that these muscles sort of do this. And a little tiny bit can be normal, but normal is none. So like Kai here has none today, which is good because we had a hard workout this morning, and she's telling me that she's pretty solid after that. But there are many horses that I will pick up this muscle right here, and it's extremely painful for them, and that's telling me that we without a doubt have back pain. So again, then it's all about where is that back pain coming from and why. So we've established, you know, kind of this area is saddle fit, this area is saddle fit. There's the disease du jour, which is kissing spines. So let's go over a little bit about how you can evaluate just standing on the cross ties if kissing spines may be a problem for your horse. All right, so kissing spines is technically called overriding dorsal spinous processes. And the dorsal spinous processes come up like shark fins, basically, off the top of the spinal column. And they should have space between them. In kissing spines, they override or do this. So one of the things that we can do is ask horses to do subtle movement of the spine and see if we can feel those wiggling back and forth like this. So if we're looking at a top-down view, we're making the spine do this from the top. All right, so the way that we do this is I get a hold of the tail and just have my hand around it. And then I'm gonna put my hand up on the furthest forward that I can reach, which for me is usually the back of the withers. And I'm going to start pushing and pulling ever so slightly on her tail while I run my fingers down the top of the spine. And what you're gonna feel is that there's movement back and forth of these spinous processes as you do it. As you get farther back, that movement gets less and less. And for some horses, you'll feel more movement on one side than the other. So I always do this on both sides of the horse, but I run my way all the way back and make sure that I A, feel motion, and B, that the horse isn't particularly painful to pressure here. So I usually do that, then follow it with firm pressure right on the top of the dorsal spinous processes. And that just gives me an idea of how well all this is moving and if we have a pain source here. I will say that often our actual kissing spine horses are not particularly painful to pressure straight down like people would think they would be, because it's more the movement of the back that actually hurts. So they will react pretty strongly to that wiggling back and forth and tell you that they don't like it. And it's something you can do on your own horse on a regular basis. You can get a feel for how do they feel when I do this. And if they have changes, then you've got an early warning system that not necessarily, again, they have kissing spine, but probably that they have some tightness in their back that you need to address and talk with your veterinarian that you have a great relationship with about how to manage that tightness through the back. So this is a quick and easy way that you can evaluate your horse's back and just get some information. I want to emphasize that this is information. A lot of it is not straight up diagnostic for a cause, but isolating where the pain is coming from and then working with your veterinarian to help diagnose the actual cause of pain for your horse will go miles towards making your horse happy and healthy.